Okay, hello and welcome to today's Spatial Analytics and Data Seminar, SAD 2020, SAD 2021, it's all the same. Today we're delighted to welcome Rafa Pereira for a talk on transport and inequalities and access to opportunities. Rafa holds a PhD in geography from Oxford University and works as a researcher and policy analyst at IPEA, the Brazilian Institute for Applied Economic Research. His research looks broadly at how urban and transport policies shape the spatial organizations of cities, human mobility patterns, as well as their impacts on social and health inequalities. Rafa is particularly interested in the equity concerns underlying impact assessments of urban and transport policies. In 2019, he received the award for Best PhD Thesis in Transportation from the American Association of Geographers and the Young Researcher of the Year award awarded by the International Transport Forum. We are delighted to have you here with us today. And I will turn it over to you in just one moment. I welcome our audience today and just wanted to let you know, if this is your first time joining us, that we'll use the Q&A function, which should be at the bottom of your Zoom window, to handle all of the discussion and questions after Rafa's done speaking. So please do, as he's talking, just drop your questions and comments in there, and that'll get us started after his talk. Thank you so much.
Hi guys, should I start? Okay, so thank you Levi and Rachel so much for the opportunity to be presenting here. I've been following the SAD seminar series over the YouTube channel, and it's been an amazing lineup of speakers, and I'm really excited to be sharing a little bit of the work I've been doing at IPEA. Let me just start sharing my screen and then we'll kick off. Share screen. Wait. Perfect. Yeah. Good. I assume you can see it. Okay, good. So today I'll be talking about a research agenda that I've been developing since the PhD, and it's about transport inequalities and access to opportunities. So in my presentation, I'll try to briefly cover three specific points. One of them is I'll give an overview of the Access to Opportunities project, which is kind of an umbrella project that encompasses most of the research agenda that I'm leading at IPEA. I'll present very briefly an application of how we can use some of the data that we are developing in the Access to Opportunities project to analyze access inequalities and access to COVID-19 healthcare. And finally, if I have a bit of time, I will just quickly mention a few of the tools that we are building along the way to share data and analyze data. And I mean, mostly spatial and transportation data. So I know the audience of the SAD seminar series can be quite broad. So to kick off my presentation, I just wanted to have a very brief definition of concepts to make sure we're all on the same page. So along my presentation, you realize I'm not talking so much about mobility, and I'm talking more about accessibility. So I just wanted to make sure that we are all on the same page, and that these two concepts are quite different. People from transport geography and geography in general will be very familiar with the differences, but I think it's important to define them here. So when we talk about mobility, we are usually thinking about daily travel behavior. So this is the actual travel patterns that people have in their day to day. So what time you leave your house, what transport mode you use, what's your commuting time, your transport mode, and so on. Accessibility, on the other hand, it's not so much about the trip that you take, but it's about if you wanted to make a trip to access a given activity in space, how easy would that be for you? So accessibility is not about the trip itself, but it's about the potential mobility. It's about the ease of reaching opportunities. And I'd really like to show these two pictures because I think they can help us get this difference very clear. These two pictures are in the city of Rio de Janeiro in Brazil. The one on the left is a picture where you see really wide avenues with a lot of cars going blazing fast, with a lot of movement and a lot of speed. This is a type of situation where you see a lot of movement, a lot of mobility, but it has very low accessibility. So if you put a pedestrian, for example, in the sidewalk on the left-hand side of the picture, that person would probably have a hard time in reaching the closest healthcare facility or grocery stores or school, for example, just because the land use occupation is not so dense. The picture on the right-hand side, on the other hand, is in the city center of Rio, but this could be the city center of pretty much any medium and large-sized city in Brazil. And you do have some transport network with public buses and subway and cars. But the thing is, what makes this place special is that you have such a high density and mixed use of activities with grocery stores, pharmacies, housing activity, and so on, that you don't really need to travel at 60 kilometers per hour to reach an opportunity. Just by walking in 15, 20 minutes, you can reach a really wide spectrum of activities. So I think these two pictures help us visualize very, very clear that mobility does not always bring you accessibility, and oftentimes you don't need to have very high speeds to have very high accessibility. And in the project that we'll be talking today, I'll be looking mostly at accessibility. In Brazil, most of the researchers and transport agencies often talk about mobility, but the topic of accessibility is really overlooked in Latin America in general, in Brazil in particular. So trying to fill this gap, we developed the Access to Opportunities project, and the project has three aims. The first aim, what we want to do is to generate annual estimates of access to employment, health services, and education services by transport mode in Brazil's largest urban areas. The second one is that we want to share all the data outputs, the code that we use, and the data results in interactive data visualizations. And ultimately, what we want to achieve with this project is really to produce open information and open data sets that can help inform policymaking and policy evaluation. So in the scope of the project, we are planning to do one round of analysis for each year. So we have already calculated 2019, but we are redoing a batch of analysis since 2017, 18, and 19. And we expect the project will go at least until 2022. We have funding secured for that. If the project continues after that, it might depend on the future opportunities. But as it stands, the scope of the project includes opportunities in terms of employment opportunities, public health services, and education. And when I talk about health services, we're looking at healthcare facilities of basic, medium, and high complexity. And schools, we're looking at primary child education and high school level. And we're calculating accessibility to all of these different opportunities by different transport modes, including walking, cycling, and public transport. We might be able to include accessibility by cars in the near future. But for now, we're only looking at active transportation and public transport. 2019, as I said, was the first year of the project, so we already have a round for that. And in that first round of the project, we included the 20 most populous urban areas or cities in Brazil. So you have a list of them in the map in front of you. And you see that the cities in green on top of the picture, those are the cities for which we could include accessibility analysis by both active transportation modes, but also by public transport. Because we couldn't get public transport data for the rest of the cities, but we are planning to expand the project to include at least 3 more cities in the rounds of this year. So to do this, we combine a large amount of data from very different sources. So we use administrative records from which we get the geolocation of employment, healthcare facilities, schools, and also public transport data in standard GTFS format. We also combine this information with household surveys, including the population census, satellite imagery data, so we can get the terrain elevation or topography, which is very important for routing or for cyclists and pedestrians. And we combine this with OpenStreetMap so we get the street network of cities. Particularly in the global south, OpenStreetMap has a very good and reliable quality for large cities. So we are very comfortable in using OpenStreetMaps in this project. If we were to use to analyze very small towns, then perhaps OpenStreetMaps wouldn't be the best option. But for the 20 largest cities in the country, I think it's perfectly fine. Okay, so how we do this? So basically, we divide each city in a hexagonal grid using the H3 index developed by Uber. So we use a very high spatial resolution grid. So each hexagon is less than 1 square kilometer in area. And it has a 350 meters in short diagonal. So I would say that within each hexagonal cell, you would have possibly 1 or 2 city blocks. So what we want to do now is really to calculate from each hexagon, if you wanted to go from that hexagon to the nearest hexagon and to the next one and to the next one, how long would it take you to, if you did this trip by walking, by cycling, or taking public transport? So imagine that you're going on Google Maps and you want to say you want to go from your house and you want to go to your employment, or you want to visit your grandmother. And Google Maps will tell you, you walk out your building, you walk along the street, wait on this bus stop for 15 minutes, then bus number 20 will come up, you hop on the bus will go on this route and so on. And Google Maps will tell you exactly the amount of time that it will take you to go from door to door, from origin to destination, considering travel time, in the vehicle, but also walking time, waiting time, and so on and so forth. So what we want to do is to have, just like in Google Maps, a very realistic travel time estimate of door-to-door trip, but we wouldn't be able to do this using OpenStreetMap because, using Google Maps, because we have too many cities and too many hexagonal cells. So we do this on our own using a bunch of open source software, including OpenTripPlanner, which is a routing engine, some Python scripts in R. And we calculate a travel time matrix from every hexagon to every other hexagon every 15 minutes during peak and off peak. This, for the year of 2019, we had over 1.6 billion queries. So this is something that you can imagine that would not be possible to be done using Google Maps API, because it would cost a fortune. And in our case, we're using our computational cluster in the server, which is not a super machine, but it allows us to do these computations in less than 27 hours, which is quite amazing using parallel computing. So, okay, now, so we know for each hexagonal cell, how many, when we combine all those data sources, we know how many people live in each hexagonal cell, how many schools are there, how many jobs, how many healthcare facilities, and we know how long does it take to go from every place to every other place. Once you have this travel time matrices and all this data combined, you can do all sorts of accessibility analysis. And if you're familiar with the accessibility literature, you will know that there are, I wouldn't say hundreds, but definitely several dozens of different accessibility indicators. So for the initial phase of the project, we started with only 2 simple indicators, which are very easy to calculate, but most importantly, they're very easy to communicate with policymakers. The first one is this one here. So this map in front of you shows you the travel time to get from each hexagon to the closest healthcare facility using public transport in the city of Rio de Janeiro. On the top map, you see healthcare facilities of medium complexity, and at the bottom you see hospitals and healthcare facilities with high complexity services. Places with yellowish colors are places from which you would take less than 5 minutes to arrive at a hospital. Places colored in green are places from where you would take something between 10 and 20 minutes. And places in blue, dark blue, are places from where you would take over 30 minutes by public transport to reach the closest healthcare facility. This is a very simple map. People have been doing this kind of analysis for decades now in geography and spatial analysis. So this is not new for anyone. But it's surprising that when we show a map like this to policymakers, and especially local transport authorities and mayors here in Brazil, during my entire presentation, people are kind of almost slipping to some extent. But when I show this map, they immediately wake up because they look at a map like this and they clearly understand what the map is telling them. You can clearly see where the hospitals are located, but most importantly, you can clearly see where we have desert of opportunities, places where you have very little or no supply of healthcare facilities, and places from where a person would not be able to reach a healthcare facility easily, just because there is no public transport connection between that place and the hospital. So I think it's a quite interesting image to convey a very compelling idea about an information that is necessary and important for planning the changes to your public transport network, but also expansion of your healthcare network as well. The second indicator is also a very traditional and commonly used indicator, which is called the Commutative Opportunity Metric. So let's focus on this map on the left-hand side here. So this is the city of São Paulo. And this map is showing the proportion of jobs that can be accessible, that can be accessed under 60 minutes by public transport. And I really love this map because it is not a map about the spatial distribution of jobs. It's about how the spatial distribution of jobs interacts with the spatial and temporal distribution of the public transport network. So immediately you see some high capacity transport corridors in the city of São Paulo. If you're familiar with the city, you immediately recognize the corridor, the subway and train corridors in the city and BRT. This is the bus corridor as well. And one of the nice things about this is that when you look here at the east side of São Paulo, you see a very, this is what is known as the Zona Leste. One of the poorest regions of the city of São Paulo, very economically deprived with some issues with socioeconomic indicators and very little economic activity. And despite being in the middle of an opportunity desert with very few employment opportunities, you can see that there is a very bright yellow spot here. This is a subway station. So this is actually showing that even for those people who live in the far east side in an economically deprived area, if you live nearby the subway station, or you can take advantage of the advantage of taking a bus and connecting with the subway station, you can very quickly reach the employment opportunities that are mostly concentrated in the city center. So imagine that you can do this kind of, so we are producing this analysis, this data outputs. So you can do this kind of maps analysis for primary schools, child education, high school, jobs, healthcare facilities by walking, cycling, public transport with different indicators. So you can imagine the amount of different combinations of what you can do with this. And obviously we are just scratching the surface of what is possible to do with that. One thing for sure that is definitely important for us in the Access to Opportunities project is to look at inequalities in access to opportunities. So if you take the city of São Paulo, for example, and you calculate, there are dozens of different ways in which you can measure inequalities using Gini coefficients, Lorentz curves, tail index, and so on. One index that is very helpful to understand inequalities in transport accessibility is what we call the Palmer ratio. So basically what we're doing here is we are calculating the number of jobs that is accessible on average by the 10% richest of the population. And we divide that number by the average accessibility of the 40 poorest population. So this is the Palmer ratio. And here we're looking at number of jobs accessible by walking within 30 minutes. The chart that is in front of you is telling you that in the city of São Paulo, the Palmer ratio equals to 9.5. This means that high income people in the city of São Paulo can can access, on average, 9.5 more employment opportunities than the poorest population, just by walking in 30 minutes around their house. Even in so you can see, obviously, there are very marked inequalities in pretty much every city. Cities are very different from one another. And even the city with the lowest level of inequality, which is here at the bottom of the picture, the city of Maceió, even in Maceió, the richest population can still access almost twice as many jobs as the number accessible by the poorest population. So I think this very quick chart, I hope it will instigate your curiosity to understand how the urban fabric and the urban type of development that we have in Brazil is very much unequal, and how this kind of analysis can help us unveil this spatial inequalities in not only in the spatial distribution of jobs, but in urban development, but also in how different population groups by income, by race, by gender, and how they can have very marked different levels of inequality to opportunities. Thinking that ultimately we know that the level of inequality that you have to public services, schools, hospitals, and jobs, it can ultimately affect your employment outcomes, your education outcomes, and your health outcomes as well. So this is paramount for us to understand social inequalities more broadly, is to think about how the concept of accessibility can help us bring the spatial dimension to the surface. So we look at social inequalities with a transportation or spatial lenses. So this is the first part of my talk, and I think I've already talked too much, but I will quickly present the second part of my presentation. So this is a preprint. It has been under review for a while now. We're waiting to hear from the editor. And so with the beginning of the pandemic of the COVID-19 in Brazil in early February, March last year, we thought, okay, what can we do with the data that we have to help local governments to cope with the situation? So relatively quickly, because we already had some of the data analysis for the Access to Opportunities project, we managed to relatively quickly write a policy brief research paper looking at geographic access to COVID-19 in the 20 largest cities in Brazil. Later on that last year, we developed the paper even further to get it a little bit more edgy about methods and policy implications, and we submitted to a journal. So we're waiting now for the reviewers and editor response. But I just wanted to briefly show you some of the preliminary results that we have in the paper. So what we do with this paper, you can access on this DOI address on the screen. So what we do with this paper is really, like, we do a lot of things, but we do, like, the main purpose of the study is really to do two things. The first one is to map vulnerable population with poor access to healthcare facilities. So we wanted to help local authorities identify what are the places that they should probably take more care of and look more carefully in terms of helping vulnerable population and having access to those services. The second one is that we wanted to estimate spatial, income, and racial inequalities in access to ICU beds and mechanical ventilators using a new accessibility indicator that is the Balanced Flowed Catchment Area, BFCA. So in the first, I'll talk a little bit about the BFCA indicator in a second, but the first aim of the paper is really a very simple analysis. And we wanted to show, for example, this is the city of Rio. The top map is telling you, is coloring on the map the hexagons where you have a vulnerable population above 50 years old with low income, people who are very dependent on public transport and very dependent on the public healthcare system. So these are the locations where this vulnerable population live, and they would have to walk further than 30 minutes to access the closest basic healthcare facility that could triage patients with suspected cases of COVID-19. In the second map, we show the locations where you have vulnerable population that live further than 5 kilometers to a hospital with an ICU bed and ventilator. So in the city of Rio, this was approximately 384,000 people. And this is pretty much 55% of all the vulnerable population live in those areas with poor access. And again, this is the kind of data analysis that's extremely simple. You would never publish a paper with a simple analysis just like this one. But this is the kind of information that local authorities really crave for, because this is telling local authorities, if you want to improve the accessibility to the most vulnerable population of your city who depend on public transport, and we know that public transport are not running as usual because of the COVID-19 pandemic. Most of these people do not have cars. They depend on the public health service. They will have a really hard time in getting access to a healthcare facility. If you want to help these people, you can probably use this kind of information in these maps to identify places in the city where you could prioritize where to build makeshift hospital, like temporary hospitals, or you can send your local health agents staff to help communicate with these people and get them into the nearest hospital if necessary. Again, this is a very helpful and useful type of information, but you wouldn't get any publication with this kind of analysis alone. So we also wanted to take a step a little bit further, because when we look at this map, it only shows you the people who will have a hard time in having access to a hospital. But the problem is this is just a simple indicator that looks at the distances, the minimum distances or minimum travel times to the healthcare facilities, and it doesn't look into the capacity of healthcare facility. And people working with access to healthcare have been concerned about this for a long time, because oftentimes the bottleneck of having access to a hospital is not so much about the distance, but it's sometimes about the congestion, that you have too many people trying to access the same hospital at the same time. So in the healthcare literature, there is a family of accessibility indicators called flowed catchment area indicators. These indicators try to do different things. They were built with different purposes and properties. But the most important advantage of this kind of indicator is that it's basically trying to calculate accessibility with congestion effects. One person can sometimes reach more than one hospital, and the same hospital can reach multiple individuals or multiple population areas. So the first indicator of this family was the two-step flowed catchment area proposed in 2000 by Radke and Mu. Since then, it has been improved, marginally improved by various authors with different indicators, including the enhanced two-step flowed catchment area, the three-step flowed catchment area, and the modified two-step flowed catchment area. Despite all of these advances in the flowed catchment area indicator family, all of these indicators is still suffer of one of the two problems, which is inflation of demand or supply. So basically, as I said, the same person can access multiple hospitals, and the same hospital can provide service to multiple populations. So most of these indicators, they would either count multiple times the same individual or the same healthcare facility when trying to accommodate supply and demand. The problem is that you end up having this inflation problem in one of the two sides of the problem. In the year of 2000, just last year, Pies and colleagues published a paper proposing a new indicator that we named the balanced flowed catchment area, which corrects for both supply and demand inflation, and it also has some nice statistical properties. If you know Antonio Pies, you know this is a very dear topic for him. So we wanted to explore the opportunity of using the BFCA, the new BFCA, to see how it would perform looking at accessibility to COVID-19 in a country where we are indeed facing bottlenecks and hospitals are struggling to cope with the demand of patients. So we have quickly three maps here. The first one on the left is basically showing each dot is the location of a hospital. The size of the blob or of the dot is the number of ICU beds per 10,000 inhabitants within a 15-kilometer radius of that hospital. Hospitals in red are regular hospitals, and hospitals in gray are temporary hospitals that were built to cope with the COVID-19 pandemic. On the right-hand side, you see the estimates of the balanced flood catchment area accessibility index. So it's basically showing how you have a much higher accessibility levels on this extreme east side of the city, close to the city center of Rio, and the accessibility levels goes down towards the west side, where you have, as you can see, much lower levels of hospital, much fewer hospitals. The thing is, so we wanted to understand how population distribution is also, how the population is distributed in relation to accessibility and healthcare services. So we created this Bichlorobi map. I can't remember the name of the map, but it's a choropleth map with two colors. So if you look only at this vertical axis here, so from purple to green, bright green, you have places with very low accessibility to very high accessibility. And from purple to pink, you see places with very low population and pink places with very high population. So when we combine the spatial distribution of population and accessibility and the location of hospitals, we have a much more interesting picture. Because basically what we want to understand here is that places which are very dark, sorry, very bright green in the map are places where you have very high accessibility and relatively very low population density. So these places are very well served and they shouldn't be really a major concern for public health authorities in that sense. On the other hand, if you look at places with very bright green, these are places where you have very little accessibility, but you still have very high population area. So this far west parts of Rio where we have very purple areas, you have places with low population and low accessibility. So it's not such a big concern. I mean, it should be looked into, but it's not such a big concern. Places in pink, on the other hand, this bright pink, are places where you have very high population and very low accessibility. So these are the places which probably need some more attention. And I think in the paper, we try to discuss this a little bit further in detail. And we believe that the combination of the balanced flood catchment area with population distributions and the Bichlorobi maps can help us understand better those different situations. Just to draw your attention to this, there is one hospital here in the far west side of Rio. And despite this hospital being here, it is the only hospital in the region. So you still have a lot of population, a lot of people in these places that have very low accessibility. Even though they live very close to a hospital, this is the only hospital in the region. So it will probably face congestion and is likely to face, it is likely to struggle with the patient demand that the hospital will receive. So once we calculate this, we know for each hexagon in the city, we know the income composition and the racial composition of each hexagon. And we want to understand how do people of different social demographics are different in terms of the level of accessibility they have when we account for the congestion effects. And when we do this, we do a comparison by income and race. So what these charts are showing is on this one on the left-hand side, we calculated the average accessibility using BFCA for the richest population and the poorest population, and we divide the average of the 10% richest by the average of the 40 poorest population. And then you see that in the city of Brasilia, the capital where I am at the moment, the richest population can have roughly over 66 times more access to healthcare facilities than the poorest population when you account for congestion effects. And you have massive inequalities in most of the cities, but you do have a few cities like São Gonçalo, Rio Grande, and Recife that have very little or very small accessibility constraints, or sorry, accessibility inequalities. This doesn't mean, however, that the level of service is sufficient in all of these cities. Many of you might have heard of the case of the city of Manaus, for example, where you have very high mortality rates because of COVID-19, and all hospitals were struggling. So it doesn't, when your level of service is not sufficient for your city as a whole, the geographic accessibility to these healthcare services is just one additional problem. But the first and foremost, the most important problem is really about the level, the capacity of your healthcare service as a whole. On the right-hand side, we calculate again accessibility inequalities by race, and we divide the average accessibility of the white population by the average accessibility of the Black population. And again, you see that cities like in Brasilia or São Paulo, white people have roughly 50% more access to healthcare services than white population. And you do have quite a few cities where you have very low racial inequalities in access to opportunities when we account for congestion effects. So this is the end of my second part of the presentation. And I just wanted to emphasize that the Access to Opportunities project is an ongoing project. We have just published last year the first results. This year, we're planning to publish the new results for 2017, 18, and 19. All the publications are publicly available. The data outputs that we produce are publicly available. On the website, you can check the interactive data visualization with maps, and you can zoom in different cities, choose your transport mode, your accessibility metric, and type of activity. I just wanted to say that at the moment, the interactive data visualization is not working. We had a problem with the server, and it's the interactive database is offline at the moment, but we'll get this fixed soon. On the website, you can also read more about the methodology, and all the code and the scripts that we use on the project are all available on GitHub as well. Again, this is a massive amount of data that we are producing. We are just scratching the surface, and I hope many of you will use this data on your papers. We definitely have lots of plans on how to use this project for for our next research projects. We are planning to include newer urban areas, new activities and transport modes. We are doing international comparative analysis using this data to compare accessibility levels in Brazil and in other cities in different places. We have a paper on this coming out soon with David Levinson and like 20 colleagues, where we compare accessibility across over 100 cities in the world. We also want to use the data outputs of this project to do some impact assessment of transportation projects. I think that the leap that we need to take in this project, but I think in geography in general, is really to look more carefully at the causal links between accessibility and social, economic, and health outcomes. And we are trying to make use of the data that we are producing to think about different papers where we can develop different methods and concepts. That some of them are in the pipeline. I hope I'll be tweeting about them soon. Finally, the third part of my presentation. And I think I have 2 minutes. Okay. So it is a big project. A lot of the project is based on this philosophy of open source data and code. And to help us do this project, we are building different tools and we want to share them with the world. So the first of them is a package called GeoBR, which is an R and Python package that allows you to download official spatial data sets of Brazil for over 23 geographies for 16 different years. including healthcare facilities, schools, indigenous lands, municipalities, census tracts, urban footprints, and so on and so forth. The package has already 20,000 downloads. It's a huge success. It makes a lot easier to download official data sets in Brazil, which used to be a nightmare until recently. And I'm very glad that the package is being very, very well received in the spatial analysis and spatial analytics community in Brazil and in other places as well. And finally, there is the R5R package, which so far it's only an R package, but we would be happy to have a collaborator to help us develop the Python version of the package. So R5R is a package for rapid realistic routing using R5 in R. So R5 is a next generation routing engine developed by the guys at Conveo with Matthew Conway, Anson Stewart, Andrew Bird, and so many other incredible people. And it is blazing fast for running multimodal routing analysis on transportation networks. So if you want to estimate travel time between places, considering the public transport network, or just by walking or cycling or by cars, you can do this very easily with just a few lines of code in R using the R5R package. Right now, one of the most standard tools for routing analysis in multimodal transport networks is OpenTripPlanner, the one that we are using currently in the project. And our first tests with R5R shows that this new tool is sometimes 6 to 22 times faster than OTP. What is really stopping us from using R5R in the Access to Opportunities project is because at the moment, R5 doesn't account for the topography or the terrain elevation for routing of cyclists and pedestrians. And we think that's very, very important to have more realistic estimates. So for now, we are sticking with OpenTripPlanner in the Access to Opportunities project, but we hope this is a shortcoming that will be overcome soon, and we can use R5 in the Access to Opportunities project and in many other projects as well. That's it. I finished with 41 minutes. Rachel and Levi, thank you so much for your time. Thank you, the audience, for your attention. I'm very glad to take questions and discuss some different points in the project. And I just wanted finally to acknowledge that this is a massive endeavor. I wouldn't be doing this by myself. So there is a huge thank you to all of my collaborators. Most of them are listed here, but some of them are not because they didn't have space. But I will make sure I include you all in the next presentation. Thanks.
Great, yeah, thanks.
Thank you so much. So to our audience, if you could drop your questions and comments into that Q&A box, that would help us get the conversation going. I mean, I suppose I can start with something sort of, I don't know, big picture, which is, what do we do when we identify these inequalities in access, especially in terms of healthcare, and we have a given distribution of people, socioeconomic characteristics, and then we have a given transportation network, and then we have a distribution of services or healthcare? Where, if you were talking to a policymaker, where would you suggest to them that they that they adjust or react? Is it in terms of transport? Is it in terms of services? Because we're probably not moving people, I guess.
Yeah, so I think there are at least two different strategies here. One of them is short-term and the other one is long-term. So the short-term strategy is in a situation like the COVID-19 pandemic we're seeing now. I think that you have to think short-term and really fast. And the best in this kind of scenario, my first suggestion is you need to make, at least in Brazilian cities, you'll probably need to build makeshift hospitals, like temporary hospitals to cope with a peak of a surge of demand.
Yeah.
And some of the maps that I was showing before, I think they're very useful in telling what are the places where you should probably consider in prioritizing where those hospitals should be built. So this would be my short-term urgent suggestion. For long-term, I would probably think about a mix between public transport networks, but also building new or expanding our healthcare capacity. So we discussed in urban planning, we discuss a lot about transit-oriented development, and I think it's a lot about how you build new healthcare facilities in the places that are needed or they're in need. But these healthcare facilities, they have to be close by large capacity transport corridors.
Yeah. Okay, that makes sense. People are being slow to give us their questions. How about you, Levi? Do you have questions?
Well, I was just curious about the kind of intended future for the initial project you presented on. I think a lot of the challenges in sort of projects that rely on some of these open data ecosystems is that they don't have a big scope for longitudinal analysis. Because oftentimes you get a really good snapshot of when that service started. Maybe you get a little bit of historical stuff, but as cities grow and change, of course, there are sometimes really big structural things that happen that significantly impact access. So I'm curious if you can speak to kind of like the long-term implications of a study like this and understanding society in this way.
Yeah, so one of the big problems that we have when it comes to urban studies and urban planning in Brazil in general is that we have a very serious lack of data. So when you think about the data at a high spatial resolution within cities where you get information at the neighborhood level, for example, or census tract level, in a country like Brazil, we only have this information updated every 10 years with the population census. So public transport networks, they change much more rapidly than that. And the spatial distribution of jobs, they also change much more rapidly than that. So what we try to do with this project, because we're using administrative records with the spatial distribution of schools, hospitals, and jobs, we try to fill in that 10-year gap of data of how cities are changing between two censuses. Obviously, we are still hostage of the population census when it comes to population data and income data and social demographics. But at least the land use information, we can get a grasp of how things are changing with the project. And it is a massive effort, because when you geocode all of the hospitals in 1 year and then in the next year, you also have to double check the consistency about whether a hospital changed from 1 year to another. And this is such a pain in the neck. But like, we have an amazing team, and I think we're doing a very good job in trying to keep track of this inconsistencies in the data. And I would love if we could keep this project doing 1 year snapshot, so one snapshot for every year. I think after 2022 being realistic, we might not be able to do that for every year, but we might do that every other year or every 3 or 4 years. But I definitely see that on the long term, a project like this has a big value to add when it comes to getting more up-to-date information in between population censuses. And I think this can have such an amazing contribution for policymakers who have to make their decisions based on up-to-date data and not looking at looking at a snapshot of how their city used to be 10 years ago or 8 years ago.
Okay.
Yeah, for sure.
We've got questions now. So we've got 3 so far. I think we'll probably have time for another 1 or 2 after that, if anyone else wanted to put one in. I'm actually going to start at the top. So Sophia asks, she says, first, it's a brilliant project. And she wanted to ask about R5R, rapid realistic routing. It's always a challenge to get good transport data. What is your experience with it?
So this is the hardest part in the project. So to run this multimodal public transport analysis, I think as a default, like of all computational tools that exist out there, I think most of them use public transport data organized in a very specific format, which is called the GTFS format, which stands for Global Transit Feed Specification. GTFS format is becoming ubiquitous, and most cities in the world are starting to use them, but not all of the cities in the world are sharing their data. And this is the hardest problem that we have to face. So in Brazil, we know that at least 15 to 20 cities have GTFS data. Thus, until now, we have only managed to have access to GTFS data of 10 cities. So in the first part of the project, we only had access to 7 cities. We managed to expand for 3 other cities now. And like, you can trust me, like we presented about the Access to Opportunities project to city mayors, local transport authorities for over 20, 25 municipalities. And it's really hard to get them to share their data. And sometimes in the case of Brazil, many local transport authorities have never heard of GTFS data before. We are talking about municipalities in the global south with people who didn't do their degrees abroad. They don't speak English very well, so they're not very familiar with the GTFS standard. So this is by far the hardest challenge. But I think if you go on Google and you can easily find GTFS data for most cities in the US, for a lot of cities in Europe as well. Not for so many cities in Southeast Asia and in Africa, unfortunately, and Latin America as well.
Super, thank you. Okay, this question comes from Emmanuel, who asks another accessibility question. As you said, there are dozens of accessibility measures. The simple ones you used, and that was in quotation marks, the simple ones you used are indeed easy to communicate. Do you have any thoughts to introduce any different accessibility measures? Is there a need for more complex accessibility measures? Thanks, presentation.
Thanks. Yeah, so that's a very good question, because we do have a boiling literature on transport accessibility that's like every 1 or 2 months you have new papers coming out, some of them with new indicators. And I do think that this off-the-shelf, easy accessibility metrics are easy to communicate. They're very good to use them when you're talking to policymakers. But they do have some shortcomings. Like when I was talking about the travel time to the closest healthcare facility, that's easy to understand, but it doesn't account for congestion effects. So you might be giving a recommendation for your policymaker to allocate a hospital on a given place. But if you're not looking into congestion effects, you might end up making things worse. So in this sense, there is always a trade-off between how scientifically sound an indicator is and how easy to communicate and understand the result. And I think we need to find a balance. There is no silver bullet indicator that will be optimum or great for every opportunity. Different cases will need different type of accessibility metrics. I think the balanced flowed catchment area is by far one of the most robust and sophisticated indicators that I've seen so far that accounts for congestion effects. But again, this is a very new indicator. It hasn't been tested out so many times yet. I think we're the first paper to actually use the BFCA after the original paper that introduced the indicator. So we need more testing on that front. But I think the BFCA would probably be my bet as a very robust indicator to explore in the next steps of our project.
Can I just ask if this is about a need for more complex indicators, or just an acknowledgement that we don't have data on a lot of aspects that we would need to have in order to really understand both behavior and access? Is
Absolutely.
it data or is it measures?
I think it's both.
Yeah.
And I think it's both. And I think, so these indicators that I showed today, travel time to the closest facility, the cumulative opportunity metric, BFCA, these are all indicators that we know that they're known to be place-based accessibility measures. So basically, I'm assuming that all individuals that live within the same hexagonal grid have exactly the same accessibility, which is certainly not true. So I can live in the same house as my grandmother. Her walking speed is different. Her capability to take public transport is very different. Her eyesight at night is different. She might be afraid of taking the bus or sexual harassment or whatever. Anyway, the thing is, most of the transportation literature use place-based accessibility measures because they are easy to measure. And we end up forgetting the human characteristics that shape the travel experience and that will ultimately shape our accessibility level. So my grandmother, let's say, she would have a lower accessibility because she's a woman, because she's an elderly person, because she has a physical disability, let's say. And I'm not accounting for that. There are a big group of person-based accessibility measures that try to account for these characteristics, as Rachel know, Levi know, and many of you will have read about. The thing is, these indicators are very data hungry. And most of the times, we don't have individual level data with the necessary information to feed in to this accessibility metrics. Sometimes you can find some of this information in household travel surveys, but they're still very hard to get by in mid-sized cities and developing countries. Okay. We recently did a paper comparing a person's subjective perception of her own accessibility and the accessibility measures that we calculate with OpenTripPlanner and so on. And you would be surprised with how different these two different accounts of accessibility are. This paper is under review, so I hope we'll get it out soon.
Great. So we've got 2 minutes and we've got 2 questions. So just I'm going to try and squeeze both of them in. So Takahiro says, thank you for your presentation. I was curious about the opportunity accessibility analysis you showed in the case of Rio. You mentioned that even poor neighborhoods have good access if they're close to transit stops, but are they able to access good jobs? That was in quotation marks. How do you take into consideration the quality of jobs, very difficult to define, into your accessibility metric? Thanks.
So what we do in the project is that we know if that job is done by a person with low education, high school level, or a university degree. So basically, we know the education. So we know we categorize each job by education level, and for people living in hexagons with low income, we only consider access to jobs with high school education or primary education. And people living in high income areas, for those people, we consider jobs with middle education and high education. So that's a very poor proxy, but that's the best we could have done so far, trying to get this qualitative match between people's abilities or educational level and jobs. That's a very, very good point.
Yeah, that was a nice question. So Chiang Jacob asks, great work. How do policymakers think about making policies around accessibility as opposed to mobility, e.g. reducing congestion?
That's the challenge. They don't. When we talk about transport with policymakers, urban and transport policymakers in Brazil and in most places in the world, they're thinking about solving traffic congestion. They're thinking about how can we increase the speed of vehicles? So they're still thinking about how you increase mobility and how you increase the speed. When you think about accessibility, obviously if you increase speed, you can increase accessibility. But most importantly, you can largely increase accessibility by reducing distance. So it is really about how you integrate transport and land use in a way that you can solve that problem without thinking about congestion. Your goal is not to solve congestion, is to improve accessibility.
Yeah. All right. I'm going to, if you don't mind, we had one last question that just fell into the Q&A from Mira. It says, thanks for the great presentation. I'm curious how the accessibility to opportunity map interacts with housing price trends. My suspicion is that efforts to provide transport and other amenities easily translates to speculative real estate development catches. In this light, securing affordable housing in opportunity-rich areas may be a harder but better measure in a way.
Yeah, so there is a really interesting literature on how accessibility to amenities, parks, green areas, and so on, they affect real estate, and there is a very strong correlation in that direction. And there is a new discussion that is coming out about how you get into the same discussion, the same analysis, gentrification, transport improvements, accessibility, and real estate markets. There are the literature on gentrification is quite unclear. There are a lot of studies saying that gentrification happens, and a lot of studies saying that actually when we don't have any strong evidence of gentrification happening as posited by the literature. There is a new, we are editing a new book where Elizabeth Dalmel is doing a literature review on gentrification, on the gentrification literature, and it's fantastic how the results in the literature are not very clear. So I think there is still a very important research avenue to pursue when it comes to the relationship between transport improvements, accessibility, gentrification, and real estate. But I wouldn't say that the relationship there is very straightforward. And that's what makes this research agenda very interesting to pursue.
All right. Thank you so much. This was fantastic. I really appreciate your taking the time.
Thank you.
I apologize. I sometimes have to, I talk too fast because I want to put too much information in the same.
This was great.
But yeah, I hope it was useful and informative for you guys.
Yes, and I'm getting lots of thank yous. Xiang Jacob also says thanks to us for the series. Well, we have a talk next week. So those of you who are still here in the audience, please join us next week. We'll be tweeting about it. And thank you, Rafa. This was excellent. Thanks to everyone.
Thank you so much, guys. Thank you, Rachel. Thank you, Levi. Thank you all for the chance. And I hope to see you in the next seminar.
Great.
Bye, everyone.
Bye-bye.